There's a superbug lurking in hospitals, gyms, public spaces, and even your own home. It's called MRSA, a bacteria that's harder to treat and spreads fast. But what exactly is MRSA? Where does it come from? And most importantly, how can you protect yourself? Stay with me as I break it all down. MRSA stands for Methicillin-Resistant Staphylococcus aureus. It's a type of staph bacteria that has become resistant to many antibiotics, making infections harder to treat. While Staphylococcus aureus is a common bacteria found on the skin, nose, and groin area of healthy individuals, MRSA is a dangerous strain that can lead to severe skin infections, pneumonia, or even bloodstream infections. MRSA is commonly found in the community, public places, hospitals, nursing homes, schools, and even gyms. It spreads through direct skin-to-skin contact, touching contaminated surfaces, or using shared items like towels, razors, and gym equipment. Because MRSA is resistant to multiple antibiotics, treating it requires stronger medications and, in some cases, hospitalization. How do you get MRSA? Anyone can get MRSA, but certain groups are more at risk, including hospital patients, healthcare workers, people with weakened immune systems, such as those with chronic illnesses or undergoing chemotherapy. People with cuts, wounds, or recent surgeries. Open skin makes it easier for MRSA to enter. Athletes and gym-goers' shared equipment and skin contact increase the risk. Those living in crowded places, prisons, military barracks, shelters, and dormitories can be breeding grounds. How to prevent MRSA? Although MRSA infections can be severe, you can take proactive measures to safeguard yourself and those around you. Since MRSA can persist on surfaces for days, reducing the risk of transmission requires consistent disinfection of high-touch areas such as gym equipment, door handles, phones, keyboards, countertops, and medical devices. Wash your hands frequently with soap and water or an alcohol-based hand sanitizer, especially after touching commonly shared surfaces. And avoid touching your eyes, nose, and mouth with dirty hands, as this increases the risk of infection. Even minor cuts, scrapes, or insect bites can serve as an entry point for MRSA. Clean all wounds immediately with soap and water and apply an antiseptic to prevent bacterial growth. Never touch or come into direct contact with open sores, abscesses, or visibly infected wounds on another person. If your loved one has MRSA, don't panic. Having MRSA doesn't mean they need to be isolated or avoided at home. Many people live healthy lives while carrying MRSA, especially in the community. Here's what you can do to keep everyone safe, without fear or isolation. Practice good hand hygiene. Wash your hands with soap and water after helping with wound care, bathroom visits, or touching shared surfaces. Keep wounds covered. If they have any open cuts or bandages, make sure they stay clean, dry, and covered. Avoid sharing personal items. Towels, razors, or toothbrushes should be personal. That's always a good habit in any household. Support good hygiene. Encourage your loved one to wash their hands regularly, especially after using the bathroom and before eating. With a little care and hygiene, you can support your loved one confidently, without fear. Clean commonly touched surfaces. A quick wipe of door handles, remote controls, and bathroom counters with household disinfectant keeps germs in check. There's no need to wear masks or gloves all the time. Everyday contact like hugging or sitting together is perfectly safe. While hospitals use extra precautions for MRSA to protect vulnerable patients, people with MRSA do not need to be isolated at home. MRSA is manageable, and your home can remain a safe, loving space. You are not alone. Knowing the risks, symptoms, and prevention strategies can protect you and your loved ones. Stay informed, stay safe. Have you or someone you know ever dealt with MRSA? Share your experience in the comments below. Like, subscribe, and turn on notifications for more expert insights on infection prevention and public health.